So this webinar is being recorded. Again, my name is Heather Wire. I am with the Healthcare Authority, and I'm sorry that I keep messing up the webinar here. I'm with the Healthcare Authority, and I manage the First Steps Maternity Support Services and not infant case management, childbirth education, and the Substance Using Pregnant program. And I'll let Shalia introduce herself.
Good morning, everyone. My name is Shalia, and I am the program manager for infant case management programs.
So we thought we'd do this a little bit differently today. Instead of doing announcements at the end, we're going to do announcements at the beginning. So those who want to hear announcements but don't want to listen to the rest of the presentation, which is kind of more focused towards First Steps, MSS, and ICM providers submitting extension requests directly into ProviderOne, they can leave if they choose. So we will do announcements, then we'll do a presentation on limitation extension requests, answer any questions, and then wrap up. So I'll start. One of our announcements that I'd like to let everyone know is that the Chemical Using Pregnant, or CUP program, the WACs have been changed to be gender neutral. And so the program is now called the Substance Using Pregnant People, or SUP program. For those that are not aware of this program, it's an inpatient hospital up to 26-day program for those who are pregnant and needing additional withdrawal management and medical stabilization due to using substances. We currently have now 5 hospitals. As of July, we now have Multicare, Good Samaritan, and Puyallup providing the SUP services, and as well as Swedish and First Hill. And we have Harbor Crest in Grace Harbor, Evergreen Monroe, and Providence Everett. The WACs have also, we updated the WAC to remove chemical dependency and updated it with withdrawal management and substance use. We also have a decision package that I will show here when we talk about the MSS decision package, in hopes of getting some funding to provide a couple hospitals on the east side of the state or Southwest Washington, some funding to open up a SUP program within hospitals so that those patients on the east side of the state don't have to travel so far to the west side. Shalia, did you want to do the next?
Yeah. So Heather and I have been conducting program monitoring, and if you all remember, this was for telemedicine and telephone visits only. We are going to put a hold on that just as we have some other responsibilities, some other things that are maybe taking a little bit more priority at the moment. We do plan to finish up and get to those who we were kind of already in the process with. So I think that we've good with communication with the other agencies that we're kind of working in the middle of with the monitoring now, but we're just going to take a brief hold. We're not sure right now how long it'll be, but we will definitely let you guys know when we plan to restart. So again, if you have any questions about that, you're always welcome to reach out and ask.
Thanks. Another announcement we wanted to let everyone know, if you are on our Gov Delivery messages, you should have received a Gov Delivery email about this. But the Healthcare Authority, as of October 1st, is now reimbursing birthing hospitals for the Eat, Sleep, Console rooming in with the birthing parents for those infants who are needing some non-pharmacological support as they are going through neonatal abstinence syndrome or neonatal opiate withdrawal syndrome. So just wanted to let everyone know that that is now something a lot of hospitals were currently doing it, but not being reimbursed for it. So Healthcare Authority is now reimbursing birthing hospitals for that service. And then the big news, save the big news for last. So I've been in my position for 8.5 years, and every year submit a concept paper in hopes that it would move forward as a decision package to ask for more units for MSS, rate increase, update the screening tool. This year was our year. The Healthcare Authority's decision, MSS concept paper was moved forward to be a decision package. And it is now currently on the Office of Financial Management, OFM's website, so that you can see what it reads. And I'm going to walk you through on how to find that decision package because it can be difficult. We will be sending out, I forgot to say this with the recording, we will be sending out a link to the recording and all documentation, the PowerPoint slides, hopefully in a week or two after we get the presentation put onto YouTube. And on the slides, you'll be able to click on the OFM's website, or you can go now to the OFM's website by typing in ofm.wa.gov. And once on their website, you can click on agency budget requests and decision packages. It will take you to this page. There's a big blue tab here that you can click on. And the link on the PowerPoint will take you to this page. Unfortunately, I can't link to the Healthcare Authority's direct OFM decision package page because every time we click on it, it goes straight to this. So once you're on this page, you're going to click on the 2023-25 regular. And then you'll see a list of pretty much all state agencies. Scroll on down to Washington. Did I go past it? I did. Go to, where is it? Oh, I'm sorry to make, I'm hopefully not making anybody sick. Okay, I thought it was under Washington. Is it not? I guess I should have done this first. Sorry, everybody. Yeah. Okay. Did I not click on the right? Transportation. Okay, let me make sure I got this right. Regular, okay. I've never had this much problem finding it. Sorry, you guys. Healthcare Authority. Shalia, are you seeing it? Am I totally skipping past it?
I haven't seen it yet.
I don't know why. I always find
Does
it
it not come up in the search bar?
There is no search bar. Okay, this is all right.
Do you see the search bar that's at the top?
No.
Oh, so I think that's so under where it says select an agency and
Oh,
or
right there.
program.
Yes.
The box. Okay, I was going to say, yeah, try that box right there at the top. There you go.
It's not coming up.
What?
Well, was it taken off?
Let me pull it up on my computer too and see if I'm able to.
Okay, I'm going to start. Whoops. Agency and budget requests. Sorry, everyone. I don't. Usually it just pops right on up for me. So.
Of course it doesn't when we are expecting and need it to.
And of course, I'm recording.
Pull it up here.
State. It's usually under Washington Health Care Authority. I'm going to click on this link. Okay, well, we will come back to this while
We
during the
will try to
recording.
find it.
Not sure what's going on. Okay, so thankfully, for the PowerPoint here, I have recorded the majority of the presentation. So during the presentation, I will go through and try to find the Healthcare Authority's website. I don't know if maybe it's down. And I am also now getting that my internet isn't unstable, so I'm going to stop my video. So we will look for that here as you listen to the recording. So now I recorded the directions on how to submit limitation extension requests so that we can make that as a separate recording that can be shared with staff who are wanting to submit extension requests directly into the system. So please send me a message through chat or Q&A if you are unable to hear the recording. Just double checking if I have share sound on. So you should be able to hear the recording. Oops. And it took me out. Okay.
This presentation will walk first steps, Maternity Support Services, MSS, and Infant Case Management, ICM, providers on how to submit limitation extension request directly into the ProviderOne system, also known as Direct Data Entry, or DDE. Why should you submit an extension request directly into the system? The requests are automatically received into ProviderOne. You can attach all backup documentation needed for processing requests, and there is less chance of the request being rejected for incorrect information. The fields you submit the information in follow the same format as the General Information for Authorization Form 13-835. Providers can continue to submit by fax if they choose not to enter and submit them directly through ProviderOne, but we strongly encourage that you enter them directly into the system. Doing so helps to ensure the information submitted is correct and there are less errors being made. It also gets the request into the system quicker. An important note is that after you have successfully submitted your extension request, the system generates a 9-digit reference number as verification that Healthcare Authority has received your request. You must not bill or perform any MSS or ICM covered services until a written approval is received. HCA's prior authorization review process has not changed, and requests will be processed in the order they are received. You will also need to ensure that all required documentation is included with your request, as well as a fax number. More information on how to submit this information will be provided in future slides. Before logging into the system, make sure that your pop-up blockers are off.
Okay, I just saw that I have a message that somebody cannot hear the presentation. Are most of you not able to hear the video? If somebody can hear the video, can you?
Heather, I can hear.
Okay, and I got a couple I can hear.
We have a few we can hear, so.
Okay. Kelly, I'm not sure what is happening. Okay, so I'm going to continue since most can hear, and then for those that aren't, we will be sending out a separate, we're hoping to put this specific part of the webinar onto a YouTube video that will also be included with the YouTube presentation.
After pop-up blockers have been turned off, you can log into ProviderOne using your domain number, username, and password. Next, choose the appropriate profile. The profiles needed to submit requests are EXT Provider Claims Submitter, EXT Provider Eligibility Checker, EXT Provider Eligibility Checker / Claims Submitter, or EXT Provider Super User. If you do not have one of these profiles, you will need to reach out to someone within your agency who is set up as a super user or has the access to update your profile. After you have logged in and chosen the appropriate profile, you will then click on the Online Prior Authorization Submission hyperlink. The information you will be entering on the next few slides is the information that is required on the General Information for Authorization form. You will need to click on the drop-down in the Organization field and choose 521-PA Maternity Support and Infant Case Management. After choosing the appropriate organization, click Next. Next, you will choose the service type code using the drop-down. If the request is for ICM, choose ICM-Infant Case Management. If for MSS, choose either PO-Post-Pregnancy Only or PPP-Prenatal/Post-Pregnancy. If a client has received any MSS during the pregnancy, PPP-Prenatal/Post-Pregnancy needs to be chosen, even if you are asking for additional units to be used only during the postpartum period. PO, post-pregnancy only, should only be used if the client did not receive any MSS during the pregnancy. Do not choose Other as a service type code. You will need to complete all required fields that have a red asterisk next to them. Enter the client's ProviderOne ID that ends in WA and make sure to include WA. Type in the client's first and last name. Then, in the Requesting Provider and Billing Provider NPI fields, enter the NPI, National Provider Identifier, that is used as the Billing Provider NPI. This is the NPI that the services will be paid to. The Requesting Provider and Billing Provider NPIs should be the same. Do not enter an individual servicing provider's NPI. Use the agency's approved MSS and ICM NPI that will be used to bill claims. In the service request line items, choose the code qualifier P. All MSS and ICM procedure codes are HCPC codes, and P is the only code qualifier used for MSS and ICM extension requests. Once the code qualifier has been selected, enter the appropriate national code. The national code is the procedure code. Choose the appropriate procedure codes for the request. The codes are listed within the MSS and ICM billing guide. If the request is for ICM, use code T1017, even if a nurse, dietitian, or behavioral health specialist will be providing the ICM services. All of the codes listed on this slide above the ICM code is for MSS only. After entering the code, enter the number of units being requested. This field does not have a red asterisk, but it is required. The from and to dates will auto-populate, so please do not change the dates. HCA staff will enter the appropriate dates when working the request. As stated in the last slide, the number of units does not have an asterisk in ProviderOne, but it is required when requesting an extension. Do not enter a dollar amount, only the number of units being requested for that procedure code listed. Once you have all of the required fields complete, click on Add Service Request Line Item. The information you entered will be moved to the bottom of the screen, and it will clear the field so that you can submit another line if needed. If you need to make a correction to a line you have added, click on the blue hyperlink number in front of the line that needs correcting. Clicking the hyperlink will repopulate the information in the service request line item. After making your correction or corrections, click on the Update Service Request Line Item button. If you need to delete an entire line, click on the Delete hyperlink on the line that needs to be deleted. The diagnosis and place of service codes are not required fields and need to be left blank. You must enter a fax number in comments as there is no other field for this information. If a fax number is not entered, the decision letter will not be faxed to your office and it will be mailed to the address on file. Once all information is complete, click on the Submit PA Request Info button at the top of the request screen. If you hit Submit and a red warning pops up at the top of the PA screen, There is an error that needs to be corrected before moving forward. This is why submitting a request DDE is better than submitting a request via fax. You can correct your mistake right away, and healthcare authority staff do not have to reject the request once it is finally in the system. Also, please note that clicking on Submit PA Request Info does not submit your request. You still have a few more steps to complete before submitting the final request. If no errors or the errors have been corrected, you will see this screen after clicking on the Submit PA Request Info button. This is the Submitted PA Request Details confirmation screen, and it will provide the PA request number that will need to be used on claims after the request has been approved. Note, you will notice that this says towards the bottom, No Records Found. That is because the required supporting backup documentation hasn't been attached to the request yet. If you want to print the authorization details prior to moving forward, you can click on the Print Details button. You will need to then attach all required documentation for the request. For MSS, you will need to attach MSS Limitation Extension Request Form and MSS Client-Specific Records showing progression, including the care plan and screening tools, as well as case conference notes, if applicable. For ICM, you will need to submit the ICM Limitation Extension Request Form and ICM Client-Specific Records showing progression, including the care plan and screening tool. You can submit the documents as one file or multiple files. Also, you do not need to attach the General Information for Authorization form. You enter that information already in the system, so the form itself is not needed. After clicking the Add Attachment button, you will see this screen, the Backup Documentation screen. Click on the Attachment Type dropdown and choose CN-Clinical Notes. You will then choose the transmission code by using the dropdown. Select WB/web for web submission. Please note, HCA is no longer accepting documentation by mail, so you need to attach the required supporting documentation via web. As a reminder, requests cannot be completed until all required information is submitted into ProviderOne. Make sure to include all required documentation. If the MSS client is screened in at the highest risk during pregnancy, please make sure to also include the case conference notes. After you have chosen Clinical Notes and Web, click on the Browse button to upload the supporting documents. After you have chosen the correct file, click OK. The supporting information will show in the Attachment List section. Documents cannot be bigger than 10 megabytes, and the file formats allowed are PDF, GIF, JPEG, DOC, DOCX, and XLSX. Also, make sure that the client's name is included on the client's chart notes so that we know the records received are for the correct client. After adding all supporting documentation, you can then submit the request. You can click on the Print Details button for a copy of the authorization information, including the supporting documentation. Again, supporting documentation is required, and the required information is outlined in the MSS and ICM billing guide. Make sure that all required documentation is attached prior to submitting your request so that there is no delay in making a decision. Once you have all of the information and backup documentation entered into the request, click Submit. If you do not click on this final Submit button, the request will not be uploaded into ProviderOne. Now that you have submitted your request, you can check the status of your request by clicking on the Prior Authorization Inquiry hyperlink on the Provider portal. You can check by entering the authorization number in the Prior Authorization Number field, or enter the NPI, the billing NPI used on the request, and the client ID ending in WA, or the provider NPI, client last name, client first name, and client date of birth. It is much easier to search using the authorization number, the 9-digit number, especially if more than one request has been submitted for the client. If your search is successful, you will see this screen. Please note, you will always see the status of error right after you have submitted your request. Error on this page does not mean that you have made a mistake. The error status will remain until Healthcare Authority staff have forced the errors. This is a list of the different statuses you may see on the request. Generally, for MSS and ICM requests, you will see error, rejected, approved, or denied. If you become stuck or have questions, first check out HCA's prior authorization webpage. If you need to include additional documentation to an already submitted request, email the First Steps program managers at hcaFirstSteps@hca.wa.gov. You can also contact the prior authorization office for assistance in submitting a request. If your question is related to MSS or ICM specifically, please reach out to the First Steps program managers, as the authorization staff cannot answer program questions.
So hopefully those steps can help you and any staff who would be entering an extension request into the system. We did have one question come through when the presentation was going, and that was, do any of the Medicaid MCOs pay for MSS, or is it all fee for service? And currently at this time, MSS and ICM are still carved out of the managed care plans and are fee for service and not through any of the managed care plans. So anyone who's in a managed care plan can still receive MSS, ICM. It's just straight through the Healthcare Authority. So some of the things that I want to make sure that we emphasize from the presentation is, one thing that I have been seeing is there are some requests that are coming in where it has an individual NPI as the requesting NPI. And so when that happens, the letters have that individual person's name on the approval letters. And so we do really ask that you use the agency approved MSS billing NPI in both the requesting NPI field and the billing NPI field. And you need to make sure it's the NPI, National Provider Identifier, that has been approved for MSS. So if you are with an agency that has multiple NPIs, you need to make sure that you're using the MSS approved NPI that will be used on the claims. If you are using an NPI that's been, or if you're using a different one for billing that's been approved in the system, the claims won't pay because it's matching up with the NPI that's used on the request. So you need to make sure that you're using the appropriate billing NPI in that billing NPI field, and also the requesting NPI field. So then that way it has that agency name on the approval letters going to the clients. Any questions on how to submit an extension request directly into ProviderOne? Please put your questions in the Q&A box and we will get to them. Any questions that you may come up with afterwards, say you're working on a request and something's not making sense, please reach out to Shirley and myself, and we can help you. So you can email that hca firststeps@hca.wa.gov email, or you can always give us a call. So once you've entered in the request and it's been approved, one thing that I've noticed is that the authorization number that was approved is not always being billed on claims. So as a reminder, if an extension is approved and all allowed units based on that risk have been provided to the client, you need to enter the approved authorization number in the prior authorization number field on the claim. So for example, if a client screens in at level A, no low risk, they're eligible for 7 units during the pregnancy and postpartum period. Though claims may still go through after you've billed 7 units, it needs to have that prior authorization number listed on the claim. If you do not have that listed, there's a chance that monies will be taken back because it will look like that the client has had used all of their eligible units, and then more were billed, which wasn't appropriate, because if that TG or TF modifier is not listed and it's just the HD modifier for no or low risk, monies will be taken back. So if you have an approval for a client who's no or low risk or moderate or even high risk, you have to make sure that once they've used up all of their allowed units, you have to list that prior authorization or reference number is how it's listed on the approval letter on the claim when billing. And I've been doing a lot of talking, so I'm going to let Shalia take the next few slides.
Great, thanks, Heather. So the next two slides are, this first one, excuse me, is the ICM extension request form. And then the next slide will go over the MSS extension request form. So just to kind of briefly go over and talk about, this is what the form looks like. When filling this out, we need to have this filled out completely, starting with the requester's name and requester's number. And with this, we do want the requester's phone number to match the person who sent the request in. A lot of times it may be, we're seeing numbers for maybe somebody else in the office or things like that. But if we do have any questions about the request that you sent in, or we need clarification on something, we're going to call the number that's listed. So please just make sure that it is the person's name who sent the request in. It just saves on time and kind of makes things go a little bit smoother. The client name, the client's date of birth, for client information, and then background information. We need to know how many ICM units have been used. Field 6, list other programs, agencies, and any community resources his family is currently involved with. So again, just making sure that those are specifically listed out. Additional medical, social, educational, and environmental risk factors or issues not identified on the client screening tool. Again, just making sure that you're providing specific details. We don't necessarily need really long responses and answers in these fields, but we need enough for there to show us to provide enough justification to give additional units. So again, we don't need, paragraphs of this and this, but we do need enough information where we read it, we see it, and we're like, okay, great. Like we can tell that this client needs additional units for this and this. So that way we're able to approve it for them. And again, briefly describing any referrals, links that were provided, taken through ICM, and then describe changes in client status or condition related to risk factors since beginning services. And then planned activities is field 10. What additional referrals, linkages, advocacy, case management, and care coordination will take place if additional units are approved. Try to avoid general, broad, generic statements in this field. So for example, instead of saying community health workers will provide resources and support, try to, for us, it really doesn't provide enough detail and justification. So something like the community health worker will help the client access the diaper bank, the food bank, and help them sign up for WIC services. So that's just a lot more detailed and specific. So for us, when we're going through approving it, it's much better than just providing a broad statement like they will support the client, they will help provide resources. Both requests for ICM and MSS should be completed and written for the individual needing units. We have noticed in the past that in the language of the field of planned activities, we can't copy and paste responses. So they do need to be specific and individual to the client that you are submitting this for. And it does need to reflect what that client needs. And again, just as a reminder, in ICM, the infant is the client. So when completing this form, activities provided should only cover ICM allowable services. So this would include the initial in-person telemedicine telehealth screening, which can include an assessment of risk factors and the development of a care plan. It can include case management and care coordination, referrals and linkages, linking the client and parents to other services and resources they may need, advocating for the client or parent, and follow-up contact with parents to ensure the care plan continues to meet the medical, social, educational, and environmental needs of the client and parents. So that's ICM. Next, we are going to move to MSS. Excuse me. So again, the form looks very similar. So we're wanting to make sure that the form is filled out completely, that the requester's name and the requester's phone number are the same, and that you're providing the client information. So the mother's name, the expected due date, or if the infant has already been born, putting in the date of birth as well. I've noticed we've seen some in the past where some of that is missing, but the infant's already been born and they don't actually, the date of birth is missing. So just make sure that, you know, you're going in and putting that in there. Again, a lot of these questions, so we're going to list other programs that this family is currently involved with. We are going to list additional risk factors or issues not identified in the screening tool. Briefly describe interventions provided and actions taken through MSS so far, and describe changes in client status or condition related to risk factors since they have begun services. And 11 is our planned activities. So what's really important to know on 11 for planned activities is that if you are asking for units from different provider types, so you're asking for 3 units from a behavioral health specialist and 6 units from the nutritionist and 8 units from the nurse, we do need you to specifically write out what each provider type will be providing. So on the form example that I have here on the screen, so this person, let's say, was asking for behavioral health services, RN, community health worker. So for behavioral health services, client will continue to receive support for depression, anxiety, and discuss coping skills and stress management during pregnancy. Client will be monitored for PPD as well. RN, client will work with RN to ensure a healthy pregnancy. Client has high blood pressure and needs additional resources on healthy exercise, nutrition. Community health worker will provide information on where to get a car seat and educate on car seat safety. So just making sure that we are actually listing out what each provider type will be assisting and doing. And again, services provided should only be covered allowable services. Covered services under MSS will include in-person telemedicine or telehealth screening of risk factors related to pregnancy and birth outcomes, a brief assessment, education related to pregnancy and parenting, brief counseling, interventions for risk factors identified in the care plan, basic health messaging, case management, care coordination, and can also include an ICM screening. If you guys have any questions or need clarification on either the ICM or the MSS extension form, you are more than welcome to put those in now or obviously after the webinar. We're always happy to answer questions as well.
Yes, thanks. And one of the things to keep in mind is that not only is there a possibility that your agency can be monitored or audited from the state or Centers for Medicare and Medicaid, CMS, same for Shirley and I when we're doing these requests. So we definitely need to make sure that there's enough justification as to why we're giving, how many units we're giving. So if we have just kind of limited information, especially in the planned activity fields, which is 10 for ICM and 11 for MSS, it's probably going to be that we do a limited approval where it'll be 4 units or something, even though you may have asked for 20. So we need to have that justification letting us know what you're going to do and why you need so many units that you're asking for. And then also, please, if you're using an interpreter at visits, put that in your request. Just mark that interpreter used at visits, because we know that that also will make visits go longer, because it's you're speaking, and then somebody needs to interpret and then get the response. So we know that those visits definitely will be longer. So put that information in as well. And as Shalia said, doesn't have to be a ton of stuff. We don't want you spending an hour on each request. We do look at the records as well. So just kind of those highlights that would really provide the justification for us to approve those units that you're requesting. I do see we have a question from this slide, whoops, on what to do with the authorization number. If you're using a vendor that's it should be, I would think that it would be similar to the CMS 1500 claim form. Prior authorization should be one of the fields that billing should be able to submit claims on. So if the prior authorization field for some reason is not within your agency, the software that you're using for billing, then you may need to go in and make an adjustment to the paid claim to add that reference number. So if it's something that's not automatically there, definitely we'll need to go in and add that number after the claim has paid. And if it's for a client who has used 30 units, that's the system won't pay past that. So in order to even have the claim pay, that reference authorization number would need to be billed in the prior authorization number field of a claim. So this is the screenshot that I used is what's directly into ProviderOne, which I know most of agencies don't bill directly into the system. They use a billing agent, but that is kind of what it would look like if you were to go into ProviderOne directly billing the claim. That is where it would go. So I, for some reason, and Shalia had sent an email, I don't know if she has a response back. Some reason the healthcare authorities decision packages that were up just a couple days ago when I looked are not showing up. So I am going to, I made a slide for another presentation.
I did just get an email, like, sorry, like
Okay.
right the second I said that. It looked like there was some errors that were in it. And so they are fixing them and plan to resubmit it by tonight. So it should be back up tomorrow.
Okay, perfect. So what I'm going to do is I'm going to pause this. So when you go into the OFM website and hopefully not ruin the PowerPoint here. When you go into the website, ofm.wa.gov, and then click on the here, I'll pull that back up again. You click on the link to go to the decision packages. You're going to click on the 2023-25 regular, and then it's not listed under H under Healthcare Authority, it's listed under Washington State Healthcare Authority. So that is where you will want to go for that. And I am going to look up. So recently I shared a quick PDF, I think, with someone as to what is requested on the decision package. So because I can't go directly into the website to show you the decision package, I can at least let you know what is on there. Let me get that pulled up. Okay, Shalia, can you see the HCA's first steps?
Yes, I can.
Okay. All right, so the decision package that we had submitted, that Healthcare Authority has submitted to the Office of Financial Management. Now, this is a request, and it's going to be reviewed by the legislatures, and the legislators are going to be the ones that look at all of the decision packages submitted throughout the state and determine which ones should be funded. So what we put in the request is we asked that we change the 2-tiered structure. So as you know, the screening has a 3-tiered structure of no low risk, moderate risk, and a high risk. We're asking that we receive funding to change it to a 2-tiered structure to allow 16 units for no low or moderate risk and 32 units for high risk when screened in during the pregnancy. And then provide an additional 8 units for no to moderate risk and 16 units for high risk to be used during the postpartum period. So what that would do is it would be 16 plus 8 units for the pregnancy through postpartum period, and then 32 plus 16 units, which would be 48 units for the pregnancy and postpartum period. So instead of having the 30 units where it's for the pregnancy and postpartum, we're asking that there be a 2-tier structure and then a specific number of units for the pregnancy, and then additional units that can be also used during the postpartum period. We are also asking for an additional 4 units to only be used for an initial screening. So instead of including the screening within the allowable units, it would be separate from that for that initial screening. And then also asking for an additional 6 units for a visit provided within the client's home or community setting, preferably by a nurse. We're still needing to talk about that, to be used within 3 to 4 weeks after delivery. Also asking for a rate increase of $10 per unit for all provider types, not just those that are licensed and credentialed, but also the community health workers as well. And then update the MSS screening tool. As many of you have asked multiple times, if we could add more social determinants of health, such as homelessness or couch surfing, to the screening tool. So hopefully we'll get approval and receive some funding to update the screening tool. The screening tool was developed in 2008, 2009. So definitely time to look at it and update it and add more health equity and social determinants of health within the tool. And then lastly, to evaluate the program to identify gaps, strengths, and weaknesses, because there was an evaluation that DSHS research data analysis did, which was awesome, but it would be great if we had some additional funding to do a really in-depth evaluation of the program. So those are the things that are currently listed on the decision package. Fingers crossed it'll go through for everything. Maybe we'll get a few, we're not sure. It's all now up in the hands of the legislators and what takes place during the legislative session. It is a long session this year. So this is kind of one of the reasons why Shelley and I are putting the monitoring on hold, because we have a strong feeling that we're going to be a little busy come this winter. So I'm noticing as I've been talking that there are questions coming in. So first question is, if a community health worker requests more units, will the nurse need to request her extra units separately, or will the requested units be shared between both disciplines? So when submitting a limitation extension request, you have to put in the request a procedure code, and the nurse, behavioral health specialist, dietitian, community health worker, and then group for MSS all have their own procedure code. And then for ICM, it just has the one procedure code of for ICM, the T1017. So if you are needing units for multiple MSS interdisciplinary team members, the request has to come in asking however many units you think that the community health worker needs, how many the nurse needs, how many the behavioral health specialist needs. Whoever is working with the client, you would submit those all on the same request. So when you're doing the request online, you would do the line for whichever provider type first, and then hit, I think it was add another line. So you can submit multiple lines on each request. Oh, it sounds like I already answered it in explanation. Next, many of our clients are very rural and isolated, which means we do longer visits because of travel time to reach them. Would you like us to specify this in the limitation extensions as well? Yes, that would be helpful. Anything that provides justification as to why you're asking for those units. So if you know you're going to need to see the client two more times and the visits are going to be an hour and a half, you can put that in, that 2 visits needed, 6 units will be used at each visit to ensure whatever, you know, like, so that justification, definitely please add that in, because that does kind of help when we're reviewing those. And another question, what about updating C for race when they speak Spanish? It does not make sense that African-American, due to their risk factors, they speak English, but if they speak Mixteco and Spanish, they don't qualify. So that, again, we want to look at the entire screening tool. So to update it and make it inclusive, and that was definitely something that to look at, because I know that when they did the screening tool back in 2008, 2009, it's very specific. If somebody's primary language is say Mixteco, but they speak a little bit of English or read a little bit of English, then they don't qualify currently. So that is something that will be looked at. The review of the screening tools, when they were developed, there was a literature review, and there was something, this was before my time. So there was something there that there was a reasoning, I guess, when they made that. So that is definitely something we'll be looking at. We'll be looking at the whole entire tool to determine what's could possibly cause a poor birth outcome. So any other questions? I think we kind of talked quickly, but again, decision package, hopefully tonight, if not tomorrow morning, it'll be online so you can read the entire thing. There is also a substance using pregnant people program decision package requesting funding to hopefully be able to entice a hospital in Eastern Washington, 1 or 2 hospitals in Eastern Washington and a hospital in Southwest Washington to become an approved SUP provider. There are a couple of other decision packages that the Healthcare Authority has out there that may be of interest. So definitely when that is up, you'll want to look at it. I wish the website was working now so that when you see it, wish I had a screenshot. When you click on it, so you click here. Oh, this one doesn't have it. But when you click on it, it's going to drop down and have additional categories. And so HCA Other is the one that MSS is under. And I think there's one that starts with this like CB or something. It's I think has to do with behavioral health. Those are the 2 that are more focused on the Medicaid side. There's also, because as you may know, that the Healthcare Authority also has the public employees benefit and the school employee benefit. So some of those decision packages are on there and they have their own topics. So once you just look at this and see, Other is the one that has the MSS and some additional decision packages. And then I think it was CB is the one that has the more of the mental health and behavioral health services. So once you click on those, you click search. This is just kind of the example. And then I'm used to having more lines here. Oh, here we go. So I think MSS is KP as in Peter or KA as in Apple. But you can scroll down, or you can do a Control F find and type in first steps, and it should then take you to that decision package. And whoops. Oh, more questions have come in. So question about being new as a First Steps coordinator. Are there any First Steps retreats or trainings available beyond the quarterly webinars? Unfortunately, there are not any specific retreats or trainings. When the program was cut back in 2009 and 2011, Department of Health used to be involved and had staff and they would do trainings. And once that was cut, unfortunately, we don't have the capacity to do trainings. However, if you have any questions or want to schedule a one-on-one with Shalia and myself, we can definitely set that up. If you want to, we can set up like an hour, hour and a half, whatever is needed. So we can do that. Anything we can do to help with what you propose to the legislature to encourage them to approve the proposal. I myself as a state employee cannot advocate and go to my legislators, but there's nothing stopping you guys. So they're the ones that will be making the decision. So if you want to advocate, feel free to. I just know that I can't, but you guys definitely can if your agency has not said that you cannot. All right, and then question on what's covered. What are the additional risk factors of social determinants of health? So there's some different factors with that. I know one of the biggest ones that's not on the screening tool, and I wish it was, is that homelessness or the couch surfing is a huge thing. We know that there's a certain thing, I'm trying to think of the word. My brain just went blank. Sorry, you guys. But there's certain factors that can cause a poor birth outcome that isn't always physical or even behavioral. And so we want to make sure that we look at everything, look at the whole picture to determine what is there that might cause somebody to have a poor birth outcome. And so we just want to make sure that we're looking at everything. As you know, right now, especially with some of the physical, it's not included, but that's why we have that limitation extension process. So I've gotten a couple recently where epilepsy is it's not on the screening tool, but it's a risk, and somebody's needing additional support and guidance with that. And so definitely you have things such as that, please submit a limitation extension request. And I think one thing we forgot to mention is also, please don't wait last minute to submit them. Our general rule is we need about 70 to 75% of the units that are available to a client used prior to submitting them, so we can see how they're progressing. We don't need all of the client records when you submit them, but we do kind of need that first visit, and then how are they looking kind of towards the middle, and then how are they looking currently. So you don't have to submit the whole entire record, but some justification, some of those visits, we do need to see the progression of how they're doing. So making sure to submit that. And then especially for those that are at the highest risk, submitting the care plan. I don't see that a lot of times, and I'm not going to hold up an extension request if that's not in there, but it is kind of helpful for my justification if that care plan is also included for those clients who are screening at the highest risk. And I am not, so next question is there a specific advocacy day or week for the Healthcare Authority? I am not aware of any specific day or week. I just know when the legislative session begins, there is, if you go to the website and there's certain bills start popping up and you see one that's hopefully for the First Steps MSS, I believe there's a way that you can click on something that you'll get emails when things change or when there's going to be a public hearing or blanking on the name again. But sometimes when they have where you can testify, testify on behalf of the public, I think. So once legislation starts, which I believe is in January, but sometimes there's some that are kind of start a little bit earlier. They're pre-submitted, then you can definitely keep watching the website and click on that link that'll give you the updates, because that's something that I find helpful because I don't always remember to go back and look online. So getting those updates whenever something happens with that bill kind of lets you know what's going on. And then you can also watch, they do use TVW to record most of the sessions that are open to the public. So you can also watch as well. And then it's been great. The last few years, they have been doing testimony virtually. And I believe, that there's still going to be that capability. I think they might be doing some in person and some virtual. I'm not 100% sure yet, but it's nice that with the virtual, people were able to still voice their concerns and things virtually, so that they could still be heard and didn't have to drive all the way to Olympia. Okay, so then can you clarify, will you be reviewing changes and submitting to legislature for approval? Does this mean you can in fact advocate for the changes? So it's not, we're not going to submit specific. When we were required to make changes back in 2009 and 2011, we were told that we needed to cut things by a certain percentage. And so there was review done. There was a lot of meetings with some of the MSS coordinators. So that's one thing too, is we will be making sure that we have work groups with those of you who are doing the job, because you know what's needed and what's happening out in the real world. And so legislators won't be looking specifically at the risks at the screening tool and saying, nope, can't have this, nope, can't have that. What they will hopefully fund is they'll hopefully approve funding so that we can go and move forward and do what's needed. So it's something that we would be doing internally. It's not something that they have to approve. It's kind of the general concept is what they would be approving and hopefully funding. It's not the specific wording that would be on the tool. And Lucia, please send me the email that you put in your comment here, because anything that I can have, and anything you guys have out there that you feel would help to benefit the screening tool or benefit the program, please send that to Shalia and I, because part of our job is we're going to have to be doing bill analyses, and we're going to have to write out justification as to why we need certain things. And so having studies and journal articles that we can always reference is helpful. So if you guys have any articles or studies out there that you think would be something that would help to get something added or updated on the screening tool, send them our way. And I will go back to that. This slide, so that way you guys have our email. So the HCA first steps at hca.wa.gov email, both Shalia and I are able to access that email. And Shalia, I've been doing a lot of talking. I'm so sorry. Do you have anything more?
No, I think you did a good job.
I just get a little passionate sometimes, and I just keep going and going and going.
It's all good.
So excited, 8 years, I submitted concept papers. So I'm very excited that finally it's moved forward. Now we just hopefully need to get it pushed through, that we can get everything we're asking for. And as I said too, we will be needing to form work groups and such once hopefully we're able to get some funding to do some of the requests that we've asked for. So keep in mind of that, that one day, hopefully in the near future, I'll be sending out an email asking for those that will want to participate, and those would be virtual. So, because I want to make sure that I get the voice of Washington, and I get it, I get anybody that's wanting to provide some assistance with that, and not just have it be everybody on the west side, or so I want to make sure that we have a voice for the entire state. Okay, so it's a little after 11. So if there are no more questions, I'll give it another minute. We'll give you guys back some time, and maybe you can have an early lunch. But we thank you guys so much. Also, the next webinar we're hoping to have in January. I don't think we have a topic, do we, Shalia?
Not yet.
Okay, so if you guys have any ideas,
Any topic ideas, send them our way.
Yep, or know of any speakers that would be willing to do a free presentation, let us know. We're always open for suggestions. I kind of wish that this, like, sometimes when people are typing, like in Teams, you can tell they're typing. I kind of wish on Zoom I could
So
tell
you could
somebody's
see.
typing. End this if they have a question. But again, any questions, you can always reach out to Shalia and myself. We're here to help answer any questions that you may have. Okay. All right, so I think I don't see any more questions coming in. So thank you, everybody who participated. I really appreciate it. And I'm really sorry that the website didn't work so that we could see the decision package right off the site, but please check it out. If you have any difficulty finding it in the next couple days, reach out to us and let us know, and we'll take some screenshots and walk you through how to find it.
Yes, thank you so much.
Thank you, everyone.
Have a good day.